Hello, this is the health assessment for the eyes, ears, nose, and throat for Tanya Morrow. This is my husband, Nathan. He'll be my participant today. So we'll start with the eyes and eyebrows. Nathan does not want to remove his hat. I will respect the patient's wishes. So you do wear glasses, and we just did a visual acuity of standing 20 feet away from the Snellen chart. And at a corrected visual acuity, he can see he has 20/20 vision. So moving on to the eyebrows, they are symmetrical, full. They do go from the inner margin of the nose to the outside of the eye. Eyelashes are intact. Irises are equal. Take a look if you could remove your glasses for a moment, sir. I'm just going to shine a light near your eyes. And when I shine the light in the middle of the nasal bridge, it does reflect symmetrically on both eyes. Irises are even in color and symmetrical. No signs of jaundice in his sclera. There is a little bit of conjunctival redness, but it has been a long day for Nathan. So I'll have you just follow my finger, and I'm going to bring it in towards your face. Keep looking at my finger though. Excellent. And I'm just going to assess your cardinal visual gaze. So I'll have you track my finger with your eyes. Okay, so don't move your head. Excellent. And now we'll go to the left. Wonderful. So there was a little bit of nystagmus on the left with the inferior gaze. So I am going to put some gloves on and just feel your nasolacrimal duct and your lacrimal duct. So it shouldn't hurt, but let me know if you feel any discomfort or tenderness. And ideally there's no drainage, but you haven't had any infections or anything lately. Okay. So you can close your eyes first. So you'll just feel my fingers on both sides. So this is the lacrimal duct, and it's just under the eyebrow. Okay, and then if you want to open, and you can look away, not your mouth, just your eyes. Thank you. So relax your face. Good. Any tenderness there? Excellent. And I don't see any drainage with light palpation. So Nathan, now I'm going to shine the bright light in your eyes again. This time I'm just going to look at your pupillary reaction. So far I can tell your pupils are about 4 millimeters. They are equal, round. So I am going to shine a bright light in your eyes. Okay. I'll have you just continue looking forward. Excellent. Excellent. And one more time. Perfect. So the first time I was looking at the actual pupil that had the light shined on it, and they did constrict, both of them equally, and then they actually did accommodate. So the second time I was watching the opposite pupil. So I am going to just use the light one more time, and I'm going to take a look at your sinuses to make sure they are air filled. So this shouldn't hurt either. Makes it a little difficult with the hat on, but it is possible. It's fine. Excellent. Nice and air filled. No signs of infection for this specific assessment. Just looking at your nose, it doesn't look like there's any irregularity with the bridge. Nares are even. I'm going to take a quick peek inside your nose. Also shouldn't hurt. You do have fine villus hair in there. And I can see the inferior turbinates. No obvious mucus right now, but that is the point of the hair in there to catch any mucus or debris, and then the inferior turbinate will help to cool the air, warm the air, when it enters your nasal passage. And then I'm going to assess your ears. So no hearing abnormalities, you can hear pretty evenly. So I'm going to use a tuning fork. You just activate this, and I'm going to put it behind your head. Just tell me if you can hear it evenly from both ears. I'm going to activate the tuning fork. Maybe. Do you hear it more on one side versus the other? Okay, that's good. So the next way we're going to use the tuning fork is I'm going to activate it and then put it behind your ear on your mastoid bone. And you let me know when you can no longer hear the tuning fork. And then once you can't, I'll put it in front of your ear and you tell me when you can no longer hear. Okay. Pretty basic. I'm going to activate. Okay. So your air conduction is better than your bone conduction, which makes sense. I probably didn't really activate it too well, but it's a 2-to-1 ratio, which is good. That is normal. Next, I will take a look at your lips and mouth. So lips are pink. They are symmetrical. Your skin is well hydrated. I don't notice any open lesions or sores. You do have the facial hair, makes it sort of difficult to assess, but not impossible. So I'll have you open your mouth and I'll take a look at your teeth and keep good. Good. Teeth, your gingival margins are intact and pink. They are well adhered to your teeth. Teeth are evenly spaced. I don't notice any obvious cavities or missing teeth. You can open now and I'll take a look at the roof of your mouth. Good. So hard palate's intact. It's kind of a light pink. Soft palate also looks more vascular. You can stick your tongue out. Good. Even movement with that. Straightforward. Good. I'm going to use some gauze and just move your tongue out of the way like you do at the dentist, just to look for any abnormalities underneath your tongue, okay? So stick your tongue out all the way. Just look. Excellent. Thank you. And I do want to take a look at your uvula and tonsils. This is kind of a difficult thing to assess. It's usually easier in adults, but I'll have you stick your tongue out and say, ah. That kind of pulls everything forward. Good. And even movement. Uvula is midline, and it looks like your tonsils are not enlarged or red. No obvious drainage noted. To the back. So that's the eyes, ears, nose, and throat. And thanks, Nathan.